Andy has had some wonderful wins with his health journey. Will you just tell us a little bit about his journey up until the point that he got started with us and more about how he's progressed?
Yes, so my son Andy was diagnosed with autism, also dealing with pandas. Up until we met Dr. Doolitttle, we had been doing all kinds of things. We've done many things with diet and lifestyle changes to improve his health, and he made tremendous progress, but I feel like we were really stuck in just healing the nervous system and healing pans and pandas. Like, that's definitely still been one of our larger issues, and then just how PANS was affecting him with academics, behavior, and life. And since we started coming, Andy, he is doing so much better academically. So he was always a little boy who really wasn't able to retain information due to brain inflammation, and was just really would make progress and then would start regressing in a flare, and we wouldn't be able to get the academic progress back. And now consistently he is counting up to 50, and this is a little boy who could not count to 10 consecutively for the majority of his life. And as well as he's doing letter recognition, sounds, and I just feel like when he is still going through flares, he's just different. It's not as severe as it used to be. We're able to get through them. We feel like we have the tools that we need. That's what it is. I feel like we finally kind of have a roadmap, those tools that we really need to get him through the flare, and really be able to not have as many symptoms. So for Andy, one of the big things was night terrors forever, and that was a big one, and we haven't had any night terrors since starting with you. We have honestly been able to completely close that chapter, which was a big issue for him for many years, as well as the potty training. So he was potty trained finally through the day, but not into the night. And since we started with Dr. Doolitttle, he has been potty trained through the night now. We no longer have any night accidents whatsoever. We haven't had any in months, which is huge. We were finally able to say goodbye to diapers and the overnight jumpers and all the things. So it's just been really, really good to have him fully potty trained. And then, like I said, just I feel like he has reached a new milestone developmentally. Yes. Just where we're kind of tapping into that side of the brain that for a really long time we didn't really have access to. And now I feel like we're sort of clearing all that, and we're getting that part and those abilities for him back, restored. Yes. And so we've been seeing a lot of progress in those areas, and even more so just his little personality. Yes. So little things, communication was a big part of his diagnosis. He was actually diagnosed with apraxia. Many speech therapists were telling me you won't even be able to speak, but we did get him conversational. But even more so now, his ability to express more of those intricate thoughts and recalling information, that's been really great. And just questions that he thinks of on his own, very intuitive questions that are more age appropriate, Mommy, why did God make the world? Or what, things that are a little more complex for a child his age. So we are definitely getting back to the restoration of the brain and areas that are being unleashed that we weren't able to do before. No matter a lot of the different, methods that we had used, and we saw obviously tremendous progress, but we're really making progress that's now sustainable. And I feel like that's been the biggest difference too, is just it being sustainable. Yes. And it's not losing it. Right. Even through upcoming, illnesses and life, losing teeth and all the things that comes. I know moms who see this, who have children with PANS, you understand what that's like. And so just being in a place where we know that we're actually making progress and the symptoms are decreasing over time, that is us on the right road, on the right path. So
that's exactly right. Oh, beautiful. Thank you so much for sharing. How has it been with the complexities of, say, the nutritional compounds that we add in, or the therapies that we're doing treatments with? what are some of the greater wins that you've seen with these? And do you think it's like the combination and how quickly we're able to pivot or how much we change or alter, and you as the mother listening to his symptoms and seeing that there needs to be a change? And then that's why I think it's so important to have a practitioner that listens to the symptoms and is willing to add in the right types of nutritional compounds and just push the immune system enough.
Yes. I have really truly loved the way that you have approached everything with us, because we have, again, parents who've been through this, you're going to relate to this so much, because, you go down these paths of, well, we need this test, or we need to do this supplement, or we need to do this next thing. And you don't know what to do as a parent, right? Like, this is not something we're educated on. And so we have to just sort of take the advice and expertise, right? Like, we're trusting our practitioners with all of our heart. And sometimes that does lead us a little astray, and I'm not trying to make that sound awful, but sometimes we do end up on a path where we're like, wait a minute, we're not seeing progress, or we're actually seeing more aggression or more, issues or aggravations and things like that. But what I have found in working with you is truly just how you listen to where we're at, and I'm able to come to you as a parent, because I'm there with my son 24/7, and say to you, Dr. Leila, this is where we're at. These are the current issues that we're having. These are the things that he's reacted to in the past. And I love how you give me true guidance accordingly. And then I also feel like I can come to you with things that I've researched or that I want to do or try for Andy, or things that I'm learning and comprehending. And I feel like you're really always so wonderful to meet me where I am and say, okay, let's do this, or let's try this, or let's pivot and change this. And so it's just been really great how you've taken into consideration everything. Like, I feel like you've really taken Andy and look at a total, like, whole body picture versus sort of doing this just like broad protocol, because that is what we have experienced in the past with practitioners, is just, here's a very broad protocol for a child like Andy, who's very complex, right? And so I feel like you take into consideration all of those things, as well as the well-being of mom and dad and the whole family, because if those things are not being met too, then we also know that the child's only going to make so much progress as well if, like, the whole family is not also, like, if you're not taking into consideration where outside stressors can be coming from the mom or the dad, or just the overall stress of the family and mom's and dad's ability to, like, incorporate these things. So I just really appreciate how I've never felt as though I can't come to you and say, like, oh, well, this is kind of some of the symptoms he's having or the issues he's having, and I've read about this herb, or, what do you think about this? Or I kind of want to take these as the next steps. And I love how you actually take into consideration an effort that I pour into my son, and then guide me based off of that, and have always put us in the right path. Thank you. And so that's been absolutely huge for us. And so, being able to incorporate the right things. And I also feel like you've been very considerate of not doing excessive testing. So really only doing the things that he truly needs to better understand what's going on with Andy, so that we can treat and then go from there, versus just saying, like, okay, let's just throw out all these random tests and spend this crazy amount of money on tests that are not necessary. And I feel like I've gotten really great results and answers from the tests that we've done. Like, I feel like they've been more insightful than a lot of the tests that we've done in the past. That, again, I feel we're just like, okay, that was a waste of money, because it was such like a small snapshot of what was going on with Andy that week, versus, like, this is something Andy's been chronically dealing with for years of his life, and genetically, like, this is how his body is more likely or going to react to something, versus, again, just kind of like, let's try this without really knowing what is lying underneath that. So yes, it has been truly amazing working with you. I've learned so much from you. I know that I can count on you. I know that I can come to you with anything, and you're not going to make me feel like I can't at least discuss it with you. I have an open discussion about it. So I appreciate that.
Thank you. It's such an honor to work with you and your family. I love you all so much. I'm so thrilled to be working with Andy, and it means the world to me that he's making all of this progress. And I know he has a big mission on this earth, so I'm honored to get to support him during this part of his journey and get him to that, to where he's limitless and he's free to accomplish all the things he's going to. Bless this world.
I appreciate it. I also want to add into that your clinic is one of the very few places in the DFW area. I've done research for a very long time on this subject matter, and I've not really found many places that service kiddos with the amount of different methods that you have. So in regards to treating or helping the nervous system, the lymphatic system, and just all these different things. I feel like there's not many tools in the DFW area, especially for children.
Yes.
Especially children with chronic conditions. Like, there's not much help in the DFW area, in my opinion, in the research, for children with autism, or PANS or PANDAS, or ADHD, or other, chronic health conditions. I think we commonly hear of things like Lyme or these other things in adults, or like lupus, all these different things, right? Like, we know those things are being diagnosed in adults. And I think it's not fairly easy, but fairly simple for an adult to kind of come and find more of like a holistic wellness center, but definitely not for kids. Not for kids whatsoever. Like, our mainstream pediatricians, again, are not really giving these types of tools to parents. And so when doing research, there's not been many things that have been found, and so finding yours was kind of like a little golden treasure, in the midst of all this chaos, because there's really not much. And then, like I said, really you being a great practitioner and having all the different things that you have here at Resonance Wellness. Like, I just know if I'm like, okay, this is going on and this is going on, I know I can come here and I'm going to find something that's going to, like, I just know that I'm going to. So, and I love that you're also just, you keep up to date with also like the fact that you're open to new things that become available. Like, you're always on top of the research and educating yourself more. I don't even know how many educational certificates and licenses and all the different trainings that you have at this point, but I am sure they're numerous. So I do appreciate that. Yes, like, you're always trying to keep up with the most up to date information that is relative to helping even, like I said, kiddos who are struggling. So thank you.
Thank you so much for sharing this.
Yes.
This means the world.
Yes.
And I think it will bless so many other moms out there that are looking for answers.
Yes.
Oh.
Absolutely.
Let me
Thank
hug you. Oh my goodness.
Anyone in the DFW area that I like